can it be fixed without surgery? The vast, 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 vast majority of lower back injuries do not require surgery. They do not require surgery. And also it's important to identify what we are doing in the surgical intervention. Now, of course, if there is an emergency case to be said, we've got red flag symptoms, the cauda equina, saddle anesthesia, loss of bladder and bowel control, those kind of things, then it is important to get the necessary attention swiftly. I'm not talking about over the course of a couple of weeks, you need to go and get it checked out. But most of the time you'll go and do that and then you'll be sent home. You say, yeah, look, all's okay. Yes, it's bad, but it doesn't warrant any emergency intervention. So that means that most of you guys do not warrant emergency intervention. But even those of you that do have some kind of surgical intervention of some description, it's often a case of, well, we tried a lot of stuff, so we may as well try surgery. Many of you will be familiar with that kind of discussion. And so what is happening? Let's just suppose it's going to be the case of the herniated disc, right? What is the problem here? What is the surgery being done? The surgery being done in this particular case is operating to remove this bit of disc here. That is what the surgery is doing. The success, I think you'll find in conversation, and of course it's worth having this certainly with your surgeon beforehand. What is success in this surgery? What would you classify as a successful surgery? And you're reasonably likely to find that a successful surgery means that this bit of disc has been successfully removed without any complications. That doesn't sound like healed. That doesn't sound like better again. That sounds like this bit of disc has been removed. But what is the problem in this case? The problem is partially that the disc is pressing on the nerve, perhaps in this scenario, but it is the fact that the annulus fibrosus, the posterior fibers of the disc here, that this has just broken through, are damaged. And those are not healed miraculously after 24 hours after you've had surgery. Those remain injured, remain in need of care and attention and rehabilitation for the weeks and months after the surgery. And so if we haven't been given guidance, we had one of the individuals, I don't know if they remember or not, posting on the live last week, one of the lives, and they said, I spent 10 grand, 10,000 pounds, about 15,000 US dollars on a surgery, and I don't feel like I'm better afterwards, or something to that effect. And there was no discussion of rehabilitation. It was do this and then bye. And that too often is the case. So if you're going to see any sort of clinical consultations with your spine specialists, with your orthopedic surgeons or your neurosurgeons, there better be some element of rehabilitation guidance, and it better be taken seriously, because that's going to be, really, I would argue, the make or break, whether things are going to be, quote unquote, successful in your eyes or not.